Coming up in 5, interview with Dr. Adrian Rhudd, consultant urologist, Mount St. John's Medical Center. Okay, so going back to men in their 20s, and usually it's a period of exploration, exploitation, of heightened awareness, all those fancy things that come with youth, but that does not mean one may not have an issue. But the issue of sexual dysfunction appears very early, and some young persons do have challenge. Correct. It's not something to be ashamed about, but
not at all. So this sexual dysfunction topic is massive. It ranges from difficulty with getting an erection, difficulty with lasting, particularly premature ejaculation. There are difficulties with actually ejaculating, where you have sex for so long that you cannot climax. And then there are people that do not get the sense of satisfaction from sexual intercourse. There are many different aspects to sexual dysfunction. The common one is erectile dysfunction, where the man just cannot get an erection. Now, as a urologist, we deal with a lot of sexual health issues. We can try to determine what is the cause. Sometimes psychosocial things going on. A lot of times we mention stress, but it is a real thing. You may have difficulties with your partner, you may have difficulties with what is going on. I mean, we're going through a very stressful period now with Corona and COVID. A lot of people are worrying about bills, partners, health, and that can affect your sexual function. There are also medical conditions, things like smoking, things like drug use, alcohol, which can affect people's erections. What we can do is tease out what is the cause, and then we can try to determine what we can correct. And then depending on what can be corrected or not, we may have to prescribe medications and even surgical options.
Mm-hmm. So it brings me to a question I perhaps should have asked earlier. What are some of the things men should be mindful of? And when I say men, I guess manhood start from your early 20s. What are some of the things I should be mindful of to protect my masculinity or my male health?
So that's a very broad question, but I think anybody, both men and women, particularly men, need to be aware of their mental, physical, sexual health. Exercise is important. You need to be exercising 3-4 times a week, more days than not, and you have to sweat. A lot of people say, I work, I walk up and down, I exercise. You need vigorous activity for at least 30 to 45 minutes, which causes you to sweat. The diet is very, very, very important. Now, there's a lot about reducing red meat intake, reducing meats at all. What you do need is to reduce salt content, reduce sugar content. So if you are still tipping salt in your food, that's a no-no. A lot of food already has natural salt, and table salt is bad. It raises your pressure, it predisposes you to diabetes, the sodas, the processed food, because what eventually happens is all of these bad things that we eat cause long-term damage to the blood vessels. The penis, for you to have a good erection, requires good blood flow. As you damage the blood vessels and you narrow the blood vessels, you can't get that blood flow, so you can't get that firm, strong erection that men and women so desire.
So I'm going to focus on two other stuff. I'm looking at enhancers. I'm sure I hear it on the radio talking about enhancers, and I'm sure other persons use it, whether it's Viagra, whatever it is that's out there. How is that? Is it necessary, and how does that impact your body?
Male enhancers are any drugs which are used to increase or what I would say is to get an erection. So when you have a problem with getting an erection, the first line treatment is a drug. The class of drugs are called PDE5 inhibitors, for which Viagra was one of the first and most popular. So what that medication helps to do is to relax those same blood vessels that I spoke about. So if they're tight, if they're blocked by all the gunk from the long-standing diabetes, hypertension, cholesterol, you take that medication, it opens up the blood vessel, blood flow to the penis and a nice erection. While it opens the blood vessels to the penis, it opens the blood vessels to everything else. And for some people, if you take blood away from the heart to put it in the penis, you will die. Or you can get a heart attack. So that's the thing why people say you should not take these medications without seeing your doctor first, because it can be very fatal. And there have been incidents where men have taken lots of stuff, gone to have a night out, and then end up dead below or on top of their partner. So the first thing is to ensure you don't have any heart problem. The next thing is to ensure there's nothing reversible, and then you can take these medications. So right now there are many medications. There's Viagra, there's Cialis, there are a few others which are readily available. These are the medical stuff. Now, of course, there are lots of stuff off label, off the market. You've heard of stone, you've heard of Spanish fly, you've heard of lots of things. The trick with those things is we're not always sure what is in them and what quantity and how they interact with other stuff. There will be some people that will take them and they'll swear by them, but medically it's very hard to tell what the ingredients are. When you are prescribed Viagra, Cialis, you know exactly what dose, what you're getting, how long it lasts. So we prefer to prescribe these sorts of things and can measure the effect.
So I'm hearing clearly that you're saying if I'm having a problem with erection, my first course of action should not be to get something, over the counter or by the wayside, etc. But I should have a conversation with my doctor.
Correct.
First and foremost, and then based on our conversation, we determine where we go from there.
Younger men tend to dabble in stuff, and younger men are less likely to have the cardiac conditions, but particularly the older men above 50 really should be evaluated first because they can have a fatal event.
Mm-hmm.